Hi, I'm Virginia, and welcome to the Health Creators Podcast, where we talk about the impact and business of being a health creator. Here with me today is Dr. David Hindmarsh. It's lovely to see you today, and also it's our first time meeting like face to face. Otherwise, we've just been messaging and stuff. So, how are you? And thank you for being here today.
I'm very well. I would like to clarify, just for anyone who's listening who knows my wife, that this was through the YouTube healthcare content creators
Yes.
course. Sort of like I think we were both on it together. I'd sort of seen some of the stuff you were doing. You had helped me out with some of my content, and I'd helped, and we'd sort of been back and forth, which has been awesome and really, really helpful, because there doesn't seem to be very many of us about. So actually any help we can give is much appreciated. Sorry, I'll do my proper intro. I'm Dr. David Hindmarsh. I'm a GP. So for your international audience, it's a family doctor. So I sort of see a bit of everything, based out of England, UK. I have multiple strings to my bow. So I run a GP education YouTube channel, GP Templates. I run our own practice channel at Eaglescliffe Medical Practice. I also work closely with one of our local medical schools to sort of support the students there as well. And I train future general practitioners. So a bit of everything.
Fantastic. Amazing. So, you speak to your experience, which is wonderful. And also to clarify, for my husband, that is how we met, through the YouTube health course.
Cool. It's everyone's sorted.
This podcast is the last thing my husband would watch, because I talk about YouTube enough. About 90% of our conversations is YouTube, this and that, and then 10% LinkedIn. So why did you start creating health education videos?
So I had... so from my point, it's sort of really, I've been on YouTube now since about 2017 with GP templates, and sort of been dabbling in and out of it. I then got my current job at Eaglescliffe Medical Practice about coming up to 3 years ago. And for me, it seemed to be, I love YouTube. I love pushing out videos. I probably consume far too much YouTube content as well. And it was just in that, could we marry the two together? So could I have, content out there that really, and the other bit that really bugs me is repeating myself. And so actually, could I provide content that, instead of me explaining myself to an individual patient, could I 10x that by saying, right, I'm going to push this content out. Here you go away, watch this video. If you've got any further questions, watch this, come back and see me. More than happy to do that. But actually then the second time that they come back and see you, they're more educated. They know where your headspace is at, and they get more information about it. So hopefully making to a better use of my time as a doctor and giving the patients better overall care is the aim. Grandiose aims, I know.
Brilliant. So do you also create health education videos for the other GPs that you train?
So I'm more than open to sort of collaborate. So I use a lot of, so the majority of my healthcare content is done through Canva. So a lot of that, as some of your audience will no doubt be aware, is that you can share those templates. So I've had a couple of GPs that I've worked alongside with who have said, like, right, I've done this video, say, on chronic kidney disease, and they're like, oh, brilliant, I want to do my own based on that. And I'll share the template with them and just say, there you go, knock yourself out. And it just gives them a bit of a framework, knowing that I've done a lot of the work already. They can then tweak it, adjust it, add their own branding on top of it. And very much like, there you go, have a look, see what you think.
Brilliant. So for the audience's information, if you're not familiar with Dave's videos, he will have a pre-prepared Canva set of slides, and then he will have a webcam where he records the video as he goes through the slides, and it's all health information. So those are the types of templates. And you shared it with me as well, which is very helpful.
Yes. No, not at all. And you critiqued it very beautifully, and I made some major errors that you very kindly corrected me in a very nice way. So, and it's been useful to have someone sensible just to go over my work before I push it out into the big wide world.
Oh, thank you. I think that was a little bit dramatized. They weren't major. They were just tweaks for clarity for the audience. So it's just to make them a bit easier to understand.
but I think as well, it highlights that. And I'll probably come on to this a bit later, how isolating sort of creating content can be. And so it's useful to have someone who's in a similar headspace just to bounce ideas around, even just bouncing script ideas about, just to be like, oh, have you thought about this? Have you thought about this? Not in a belittling way, but just because you're doing this in isolation, sometimes you will just see ideas that you just will not see.
Yeah, and also sharing resources. So
Absolutely.
when I was creating a video about UTIs, and you showed me these resources that were made for GPs, and I was like, oh, these are fantastic. And so those were really helpful because they're resources that you wouldn't necessarily find if you were to Google for those resources.
Yep. Not helped that the particular resources are hidden away on the internet, and as you say, it's one of those. As a GP, I've had it rammed down my throat about antibiotic prescribing, and so they do not make it. Their SEO is appalling. So it's sort of one of those of like, right, have a look at this link, and it takes you right to it. So yes, more than, as you say, it's about sharing our own individual speciality areas.
Yeah, brilliant. So just again for the audience, SEO is search engine optimization. So that's about using the right keywords so that when people are searching for things, they can actually find it in the search results. So very kind of niche, kind of silos of fantastic information often don't optimize with those keywords because they're just creating it. They're kind of purpose built for GPs and things, not really for the general public to search for and find. Unlike brands where, they're probably selling, I don't know, thrush treatment and they want you to find them. So they'll make 10 pages about all those types of treatments so you can find it easily. So speaking to what you just said, what is your process for creating health videos? Take me from, where you get your ideas, your research, how you put it together, filming, editing, publishing.
Gotcha. So initial ideas is I get far too one. I look at what I'm seeing from a day-to-day basis and sort of thinking if things are cropping up because of my position within the practice as a partner, any issues with, say, like the reception staff, the people who answer the phones, if they're getting patients with recurrent issues that I think, and because now I'm in a nice position where the practice knows what I do. So they'll turn around and say like, oh, Dave, we're getting a load of calls about, so hay fever is the big one at the moment. What can you do? And you're thinking like, is it as simple as I put a Facebook post out, but actually having a video hosted on our YouTube channel can just give the phone staff to basically like, no, I'm not going to book you in with one of our team. Watch this video. If you need to speak to us after you've watched this video, then that's fine. But actually, this gives you all the information that you need. So the initial idea is listening to the staff. And actually, the staff, it's useful because it then, from my initial idea of I think we should have this, we're now in a position about a year or two down the line where actually we're getting this information through and sort of people are helping out through it. I then go on, I predominantly use Canva because I can make the presentation, sort of the background look a bit nicer. So it's not just me, blank wall, a couple of pictures. It's our practice logo, maybe classically either looking at particular drugs or a part of the body that I can easily drop those in. You've got a couple of options. So for people listening, you can get a free version. I would strongly recommend that you go out and have a play with it. I've got the professional version, which is, I would argue, very, very good value for an annual sort of subscription. I will then set out a series of slides based on around 5-10 seconds worth of talking, depending on how good I'm feeling or how much time I've got. I'll either record directly into Canva. So there's an option that you can record yourself and sort of put yourself in a little bubble or a little square, and it will capture your video and audio so that you can edit it directly in Canva. What I'm gearing towards now, because I often find, probably because of the NHS Wi-Fi and internet, is that it's probably safer if I record it, say, off my computer, off my phone. I can then tweak it as I need to and then upload that shorter video onto Canva. And then you can edit everything together in Canva, take it out. And there are ways that you can either publish it directly to YouTube, or you can just sort of you can then download it, re-upload it to whichever platform you need. But predominantly, I sort of focus on YouTube from that way. So that's the main ways I do. Sometimes if I've got more technical information, or if there's already a PowerPoint presentation there, I'll often just annotate over a pre-done PowerPoint presentation. And so interestingly, for some of my more successful videos, that's what I've done. And it seems to get the information across there, which has been great so far.
Brilliant. I think what makes me really excited to record this podcast is that everyone has figured out a way that works for them. So there's no, right or wrong way to make a YouTube video. And if you do have a plain background and you pop up pictures, it's also totally fine. That's what I do.
So, not saying that way, trying to insult them. Oh, anyway, moving swiftly on.
So in terms of your creation process, do you create a script, or do you just have everything on the slides and you know that you're just going to talk over it?
I think what I love about YouTube and the whole process is that originally I didn't. So I would feel confident enough in the topic that I could just talk around the slides. Having a look back at those videos, and actually having scripted only just recently a couple of videos on my other channel, I've realized it's a lot better. So I'm like, oh, and I think actually discussions with you, I think we'd sort of have a very different creation process when we're sort of discussing on LinkedIn, that you'd sort of like, yes, I do a script. And I said, no, I do Canva and then annotate over it. And then I'm like, I've then had a video that I just did a straight script. And I was like, oh, this is a lot slicker, a lot quicker. That you can get a free teleprompter app. And I've just downloaded that. I've not paid extra, just had it that, did the script, scrolled through, recorded, and went, oh, that's a lot better. So I will humbly eat my humble pie. So from that way. So, yeah.
Brilliant. So pro script. I'm definitely pro script. So I'm glad I've won you over. I brought you over to the script side.
I'm a convert. I will give you that. I'm an absolute convert from that aspect.
Fantastic. So from the videos you've created, you've kind of spoken around the impact already. You've managed to save lots of appointment times. And so how has that impact kind of translated into patient care? So you mentioned that it's better patient care now because they're well educated and you can have a better conversation. Do you want to just comment more on that?
Absolutely. So a couple of so I think for me, my actual medical channel, so Eaglescliffe Medical Practice as a YouTube channel is tiny. Like, it's got, in terms of any YouTube metrics, it doesn't even sniffle in terms of the impact wider. What's interesting for me locally is the impact that it has within the practice. And I'll take a couple of examples. So we have annual flu clinics. So we'll often get everyone in, we'll get a mass vaccination drive. So we'll vaccinate anywhere between 800-900 people. In the past couple of years, I've always done a video explaining the process. So to patients like, right, how to book it, what day we're doing it, what it looks like, etc., how many people. So last year it was interesting, under throwaway comments of this gentleman walked past me and said, oh, I saw your video, you said you were going to vaccinate 800 people, I'll quickly move on. So I don't think patients always appreciate our side of things, and why should they? It's not their job to, but actually because he knew, right, you're really busy, I'm going to make sure my jacket's off, my arm's exposed, I am in and out, I'm not asking daft questions and taking up your time, and get through. The other bits as well, which we've used when there was a Strep A outbreak a couple of years ago. And so I created a video to basically say, this is what you should be looking out for, because otherwise we're getting inundated with phone calls with sort of like, I'm worried about my child, he's got a sore throat, has he got this bug that's going around? And so actually what I did was write a short video and said to the reception staff, like, right, send them this link, and we've got a texting service already built in. If they're worried, I will see them. And it just reduced the impact there. In terms of actual metrics, in terms of actually people that have been able to have a real demonstrated impact, that was recently done with our local area was doing a diabetes remission service. So it was a complete total dietary replacement of, you drink basically very low calorie shakes, low diet, and you would drop down to about 800-900 calories per day. I'm lucky to have a very intelligent population, very pro health, and this service for them was like, they'll lap this up, because they'll say like, right, doc, you can get me off my medications. It's all about lifestyle. It's like, brilliant. But it's how do I communicate with that effectively? And I estimated we probably had anywhere between 70 to 100 patients who were fitted the referral criteria. So I was like, I can't bring in, it was October, November time. It's cough, cold seasons. I cannot offer 100 appointments. I cannot expect my team to organize 100 appointments. What I can do, though, is shoot a short video, which say took me an hour or two in total to edit and upload and everything, have a preset text message going, I've reviewed your notes, you might be eligible for the service, please respond back if you're interested. And then from that, we had I think it was about 15 people respond back saying, yes, I'm interested, which small numbers, I'm not here to argue that, but considering the service had audited us and said, look, in the past year, you've only referred 2 people, and we've gone from 2 people up to 15. It's a huge increase. And out of those people, they've really benefited from it. And actually the longer term impacts is that they require us less, et cetera, and, reduce prescribing, reduce costs to the NHS. Absolutely brilliant. All for the sake of the initial upfront efforts of doing this video and pushing it out. So it's then sort of like looking forward now of like, right, how can we then use repeated messages that are potentially benefit patients, but I don't want to bring you in for, such as health promotion, stop smoking, breast lump awareness, prostate cancer awareness, all these other bits and pieces of like, I don't need to see you, I don't want to bring you in, but the information I need you to know is out there and that we trust it. So yeah, that's sort of my passion speech from that point of view.
That's fantastic. It's really great that you kind of identified, if I make a short video in this, it will just reduce the absolute avalanche of patients that want my time. Yeah. So.
And that's it. And it doesn't always work, but it's at least giving, it's sort of giving them something to do, so that as soon as they booked an appointment, it's too late. It's very difficult to unbook one. So it's like, right, well, can I give you the information even before you pick up the phone, set through the door, and give you decent advice that you trust because it's from your doctor, rather than, some other healthcare professional. Not that they're wrong, but just it adds, and that's the bit I'd love to explore further, is does the fact that having an individual practice account have a wider impact than a healthcare content creator who's pushing out good advice that's correct? But, compare the two, who do they trust more? I don't know.
Yeah, I was going to say, I think that's a really interesting concept, because my next question was going to be, do you think that all practices should have someone in-house that produces videos that people can then, build that relationship with?
Yeah.
And, it will give you more confidence to kind of prescribe a video whenever pre-appointment or post-appointment. And they know that they're getting the right follow-up, because it kind of sets expectations as well.
Absolutely.
So
absolutely. Yeah. And obviously it's my passion area, so I'm going to say yes. I think it'd be awesome if like every general practice, generally they run from there are various sizes. You do get some single-handed GP practices, and you're just adding quite a lot of work onto the already overstretched service, up to some larger practices. But I think ones like, so for me, there are 7 doctors in total in the practice. We've got a practice population of around 12,000 people. So actually it's a reasonable size, about the average size for UK practices. I think, why not? And, we work for audiences, or to be honest, even the UK, they're not really aware. Generally, a group of practices will work together in what's called primary care networks. So it's generally about 4 or 5 practices who all work together. And even in there, as one of the leads who's interested in the work that I'm doing as a digital and transformation lead, so it's a set person, his job role is to help out with this. So we've sort of been chatting through ideas about like what videos would work. And then actually, if I create the Canva template and then sharing it amongst ourselves, saying like, right, well, this doctor can record their bit, I'll more than happy help out with editing and getting it right with using my expertise, and because we're trying to work as a group, you just do it, and just sort of like knowing that it will help out because you're trying to work as a team. So sorry, a very long answer to your question. I think I would love to have it as individual, but even as like a group of practices, I think it'd be a good idea, because the benefit of that is that you can speak to your practice audience, because everywhere's slightly different, as you would expect, depending on
Yeah,
what they do.
Yeah, that's absolutely true. Like you said, depending on, what the kind of health, needs are for the
Yeah.
population that you're serving. Fantastic.
And I think it's for certain practices. So you will get specific practices that are like called the university practice. So they just see students. And I think given nowadays, why aren't you? It's just like, I think it'd be great if you had the university practice has got a TikTok channel, or just something out there that's more forward, saying like, get this checked. How do I do this? And anyway, yes, sorry. I try and not rabbit on.
You don't need to apologize. I think that's a fantastic idea, because again, it just links back to your population demographic is not going to be as general as the whole internet. Like you said.
Exactly.
Yeah.
And I think with certainly, we're discussing about sort of YouTube tactics, and they're saying about find your audience, grow your audience, and then from that way, and then I look at it on the reverse of I know who my audience is. I've got them on a list on my computer. It's like, that is my audience. So it's like, I look at it in a slightly different way of going, right, well, how do I then communicate to that audience in something that they want, or will at least serve some of them? So yeah, it's interesting. It's a fun thing to do. And what I have done and what I'm trying to do is then sort of, I'm quite interested in publications, and the academic side is like, right, can we start to get an evidence base for this? Partly so that I'm not trying to shout about it and, people say, oh, just believe Dr. Dave, but more on the flip side of actually saying, well, no, these are the documented positive impacts that we have of it. And I know you very kindly put me onto a PhD student. I was more than happy to have a chat to her and give her, and I chatted to her for a long time, and I feel a bit sorry for her now, because basically it's people like her building up that evidence base, so that actually wider commissioning services could say, well, actually, right, here's a pot of money, so that individual practices has an ability to push out something on social media, whatever it may be. Anyway, that's my pipe dreams. But
anyway. I mean, we could make it a reality. That's why I'm like, if it takes one PhD student to be so interested in this, and the PhD student, for context for the audience, is not a health creator themselves. It's just that they have an independent interest on the impact of behavior change that health clinician creators can have on the behavior of, the audience that they're serving. And I think it's so fascinating that it's essentially just communicating through a different medium, because we're so used to like letters, and they just seem a little bit, how many letters do you get? How many emails do you get? But if you get a video and your doctor says, take this medicine, watch this video about it, you're probably more likely to engage with that rather than read. Yeah.
And I had one, I am that guy in the meeting. So we had a youth panel, and they're called social prescribers, but it was aimed towards the teenage young adult audience, so they can help with, say, like if people refuse and go to school, or some other just they're not quite right at home. And so I turned around and said, like, what social media have you got? And I went, and I said, like, have you got a video? Have you got something? And they went, oh, we've got nothing. And you're like, just like, and again, it goes back to provided a nice leaflet. And I'm like, surely we could do better now. Like all the information is out there. A lot of it is free. The most expensive thing that I've bought in terms of my content creation is my editing software, this microphone, and these headphones, and that's pretty much it. So, but anyway, right. I'll stop ranting.
You need to stop apologizing, because these are all like golden nuggets. So ultimately, it's very low startup cost. Probably the thing that is most essential is you, because you're putting it together, and then you are sharing that information directly with your patients. So that you are directly having an impact on whoever you share that information with as a video. And you don't need to print it, you just need internet access. And you don't need storage space either, apart from storage space for your mic and your headphones.
Yeah. Yeah.
Yeah. So what are your top tips for health creators who want to get started?
Just do it. Just do it. I think is probably my top tip. Have a chat with your team, try and get an idea of what your common, I think the big bit for me was actually getting a chat to the front desk staff of like, what are your main gripes, whinges, repeated messages? And it's that repeating. If you're repeating, right, can I condense this down to a single video so that it just eases people's time? Because instead of them having to listen for 5-10 minutes, it's a quick, here's a text, watch this video, come back to me. Sort of echoing your points, you don't spend money on equipment, or just minimize what you do. A lot of my initial videos were done on, my headphones, which were provided for me at work. If you get the microphone close enough, you get decent enough audio. I do a lot of mine either using PowerPoint, which it's majority of people have got a copy of anyway for work. I use a slightly different editing software, but it's not essential, only because of my channel. I do a lot of screenshots. But again, if I was starting afresh just for healthcare content creation, PowerPoint, Canva, all relatively free or easily available. And then just reach out, follow you on LinkedIn for all your healthcare tips. Because I think it's good actually that you're pushing out not only YouTube content creation, but actually more of the healthcare stance. And what I do enjoy, and what's brilliant about YouTube at the moment, is that they've really clearly taken on board this niche of healthcare content creators, and more importantly are supporting it, really sort of reaching out and feeling valued, which I just don't really see across other social media platforms. And actually I can see what they're doing because they want to get the best information out there, but it's great. It's actually quite an exciting time to sort of really sort of, right, can we support this? Can we build it more? And it makes you more motivated to do it.
Yeah, that's true. Because I think you've had some positive kind of hidden, unexpected benefits to putting out, even the few videos that you put out on your personal page. So you want to talk about some of the positive things that have happened because you just put yourself out there.
Yes, I think for me, so GP Templates as a channel is, because I'm a GP trainer, because I work a lot with our electronic healthcare records, it's quite complicated, and to do certain nifty things to make lives a bit easier. So instead of me in isolation do it, I'll often record myself, talk you through it. And so I'll have sort of what I call 3 branches of information that I'll push out. So I almost put computer workout. So what's called system 1 is the computer system. So I'll do a lot of how-tos on that. The one that I'm working on, because I have a lot of GP trainees, I'll push out information on that. So if they've got exams coming up, like revision tips for that, what to revise, certain niche areas that they need to really have a look at. And then third is general lifestyle stuff. So if I've read a book or been on a course that I found interesting, I'll put a review on that. And what was interesting out of all of these is that a lot of the lifestyle ones, so I went for an interview, and as part of that interview process, you had to produce a video. I knew I wasn't going to get the job, but I thought it'd be quite interesting to actually, I'll publish it. I'll be like, right, I've applied for this general practice, continuing professional development company called Red Whale. They wanted a CV and a video. Here's my video that I did. And actually off the back of that, and a separate company who works with pharmacists for their education said, we watched your video. Do you fancy doing some work with us? It seems like you know what you're on about. And I was like, wow, that's brilliant. And that professional relationship has rolled on. And then as well, some of my more nerdy how to use the computer system one actually got noticed locally. And they sort of gone like, oh, you know how to do X, Y, and Z on system 1. I've seen your videos. They're really good. You've really got a passion for it. How about you work with us as the clinical digital lead? You clearly know something about that area. And I was like, all right, sounds great for me. So what's interesting when people talk about, oh, you go into YouTube, you make loads of money. For me, like from the channel itself, not monetized, but the wider impacts almost as I put it as almost a visual representation of my CV. it's far wider impact. I sort of like, you want to see me, you want to see what I can do, just watch my channel, and it's got everything there. So yeah, and it's annoying because there are times it does take a lot of time. I'm passionate about it and I do really enjoy it, but you're getting all these positive feedback and you think, oh, I can't really quit now. So just keep going. You think at times like, oh, do I have to be editing late at night? I want to go to bed. And you're just like, but I get really positive. My trainees appreciate it. I've had some that I haven't seen. They're revising for their exams. I sent them a link saying, I've done this video. It will really help you. And they're like, oh, thanks, Dave. That's really useful. Anyway, so yes, I'm stuck now in a really happy time.
I'm stuck because it feels like it's a good problem to have. People depend on you to create your fantastic videos, and you're like, oh, well, I can't stop now.
Yeah, yeah. So believe me, I haven't got that many sort of people going. It's just the ones. I think for me, it's you look at, like, you're always going to get drawn to the large creators and think, well, I'm nowhere near there. You know, I've on my own channel, I've only just hit over 1,000 subscribers. My watch time hours are less than 1,000. Thank you very much. Thank you. So the wider impact is minimal, but I think actually from on one-on-one, even getting the ones and twos, people saying like, this is really helpful, thank you, it's like, it does really help. So, you know, it's even at the end of the day, I think I've helped out another person. That's great. Isn't life good?
Yeah.
So yeah, and also as well,
exactly, and you enjoy the process as well, so you know,
yeah, and you get
go for it.
I'm at a point now where, like, I'm on a lot of Facebook groups, certainly with other GPs, and they're saying like, oh, how do I do this? And I just sort of like, I've done a video on it, and I'm always like going like, right, if there's repeated questions, how do I do this? Like, this video might help. So yeah, it's a good place to be. It's just, yeah, trying again to balance off not adding extra work, but then I enjoy it, so it makes the other work really easy. Oh, it's fun times. What a time to be.
Yeah, it's true, and I think, you know, the only way is up. Once you start making videos, you just get better at them, you get faster at them, you think about different ways to do things, and then also, you know, if you're trying to explain something to someone that isn't physically in front of them, like how to sign into a portal to register for your flu jab or something, then you can say it to them in the appointment. But it's so different to be like, watch this video to show you exactly how to do that. And they can just follow along, and they can pause the video, watch it as many times as they like, rather than call you and say, I can't register, I don't know what I've done wrong.
Exactly that. You know? And I think what I've found is certainly people who aren't so tech savvy, it's the watching it again. So I've had a couple of people where I've explained something and they said like, I watched it 2-3 times, but I got it on the third time. It's like, brilliant. That's easy for me then.
Yeah, fantastic, because it means you don't have to physically be there or even on the phone to show them.
Yeah, exactly that. Because... They're like, oh yeah, I've got the video. Thank you.
Yeah, exactly. Fantastic. Well, thank you so much for sharing your journey and all of those insights. I hope if you've been watching or listening, you've learned a lot from this episode, and please do reach out to Dave. You know, join his Facebook group, follow all of his channels, subscribe, watch each video 12 times to get more watch hours, and follow on LinkedIn as well. Dave is lovely. Really great to speak with you, and it's really nice to, you know, just have more people in our kind of health creator, video creator circle, because I think it starts off with creating things for patients, but you can create a video for anything. And I think, you know, there's lots of opportunity out there. You just need to get started and just do it, like Dave said. So any final words, any final comments?
No, I think you hit the nail on the head. Just do it. If you're thinking about it, pick up the mic, pick up your camera, get on with it, reach out. There's loads of good information that's for free out there. Like, you know, follow your channel on LinkedIn. You get some really good healthcare content creation just to get you started out there. So just do it. Give it a go. You might enjoy yourself.
Thank you so much. Thank you for everyone if you have been watching or listening to this episode, and we'll see you at the next one. Bye.